From one physician, one dietitian, and very little research, the Celiac Centre has made major advances. We understand a lot about celiac disease. We understand more about celiac disease than any other autoimmune condition. However, we don't understand enough. There's potential for us to do that. There's potential for us to understand celiac disease fully and turn off the trigger and prevent the condition.
Until we went to the Celiac Disease Center at Columbia, no one really understood how difficult it was. They said, oh, 4 weeks after gluten-free, he should be right back to his normal self. But it wasn't that way. We had to wait. We had to be patient. It took 20 months for his blood levels to go back to normal.
As a parent, I think it's important to pick what is the best option for your child, and not just to go to what's the most convenient or the easiest choice. And learning about the center, it's clear that it has the best doctors, the best support system, the most up-to-date research. So there's really no question as to where we should be going to get Zoe treated.
Most advances in diseases have been made through studying animal models of the disease. Celiac disease has been at a great disadvantage because we've had to use just human samples, and they're very valuable and there are limited numbers. With a mouse model of a disease, specifically celiac disease, it accelerates the research, it accelerates the acquisition of knowledge because you can manipulate that mouse with its genetic makeup or the environment or the diet.
Virtually all of the research that's happened in trying to investigate the immunological basis of celiac disease as to why individuals develop celiac disease is based on human biopsy samples. These are predominantly biopsy samples from the small intestine, which yield very little material. They're a snapshot in time. They don't tell us as to what happened, let alone a couple of days. It doesn't even tell us what happened a couple of hours before the biopsy was taken, and it won't tell us what the future course of the inflammation is going to be.
In a mouse model, we're able to say, okay, this is what we specifically did to change the environment or to turn on the disease. And in that way, we can better serve our patients to say, these are things that we can avoid in you when we know you have that risk factor.
Developing a mouse model would be a boon for the researchers in the field of celiac disease. It would allow us to understand what initiates the disease. It would allow us to understand what sustains the disease. It would also allow us to figure out why certain individuals do not respond to gluten withdrawal. In addition, I think this would be a promising tool to investigate novel therapies that are being developed for celiac disease to figure out which ones are least toxic and the most efficacious.
I consider it an incredible privilege to be able to take care of patients with celiac disease. And yet, more than taking care of the individual in front of me, I feel a special responsibility at the premier center for studying celiac disease to advance the research and to think about not just helping the patient in front of me, but how to help patients who haven't yet come in, how to help patients who have not yet even been diagnosed with celiac disease, how to help the future generation.
I brought him to the doctor to say, listen, he's really sleeping a lot. What do you think is going on? And they found out he had anemia. He was very anemic. So they put him on iron. We started to see a change maybe with his attitude, second half of junior year. A kid who had always been so happy and had such zest for life hit the wall, and he just couldn't really have energy for anything anymore. It wasn't until later when his personality changed that I became really worried. Where Harry normally loved to be around a lot of people and have a lot of company. I'm one of 8, my husband's one of 8. You can imagine how big Christmas is. He just would withdraw. He just couldn't handle it. He just didn't have the energy. You don't know what's going on in his head. I mean, it's just really sad.
We sensed something beyond the norm was going on with Zoe this past summer. She, a couple of nights in a row, after we put her to bed, threw up in her crib. We thought maybe it was a milk allergy, so we went to her pediatrician. They ran a bunch of what they thought were basic tests, and luckily nothing showed up. So we gave it a couple more weeks, and she kept every couple of days throwing up even after we took milk out of her diet. She really lost her interest in going to the park and playing outside. She very much lost her interest in reading books. It was almost as if she had this kind of like fog over her. She just did not have that spirit or liveliness that we were used to seeing. It was just a totally different Zoe.
When I see children and their families, particularly young children who have celiac disease, it's understandable for there to be a lot of anxiety surrounding that initial diagnosis. And I like to impress upon them that this is something that they can do, that they've got this and we've got this with them. And I think what's so special about our center is that we really have a team-based approach to managing this. Our dietitian is instrumental in instructing families and speaking with the school and with the camp to make sure that the child's quality of life is the best that it can possibly be. And as providers, we try to give them the most up-to-date information about the disorder so that they feel that they have a good handle on what's currently going on and what's to come.
The only treatment for celiac disease is a strict gluten-free diet. It's very easy for me to say, but to put into practice can be a real challenge, especially for some patients. It's very easy also to say, get stricter, ratchet up your efforts to avoid trace exposure to gluten. But anytime that happens, it comes at a cost, and that's primarily a cost of quality of life.
The quality of life of people with celiac disease varies tremendously. Some people after diagnosis have a good quality of life, and others have a poorer quality of life. And in some individuals, it's the treatment that is affecting the quality of life. One of the things that we've been working on is the degree of adherence and the presence of hypervigilance in an individual.
The patients that had the highest adherence score did have the lower quality of life scores. We feel that that rigidity or that constant feeling of having to be vigilant may very well impact the overall quality of life. And that's something that as we learn this, we need to learn more about how we can help our patients maintain a safe gluten-free diet without sacrificing, being social and enjoying what they need to in life as well. In addition, we're starting 2 new studies where we're looking at the quality of life, eating behaviors and patterns, and the risk of any eating disorders or disordered eating in our celiac patients. With the restrictive nature of the diet, we're concerned that that may layer on, for especially some of our young adolescents, some of those disordered eating patterns, and we're concerned about that. One very important thing we found is that the quality of life scores of our patients have gotten better. They still haven't normalized to the general population, but indeed we see that some of the things we've learned and we've been able to implement have been a great benefit to our patients.
Celiac disease has gone from a condition about which we understood very little to one that we consider as one of the best understood autoimmune diseases currently. For example, we did not have a sensitive and specific markers of celiac disease just a few years ago. Now we have a biomarker of celiac disease that can identify patients with great sensitivity and specificity. We understood very little about what is the mechanism that triggers the immune response to gluten in patients with celiac disease. Now we have a pretty good understanding of that mechanism. In terms of the amount of research, in terms of the research output, including publications, this Celiac Disease Center is at the top of the field. It is the #1 celiac disease center in the country in terms of publications and research output and findings. It is here that we are going to find most of the answers that we are looking for so desperately. And it is here probably that we will eventually identify the cure or cures for celiac disease.
Dr. Green was definitely able to give us some hope that there is a bright future for treatment and eventually a cure for celiac disease. And having a young daughter at such a young age be diagnosed with this, that obviously is the best piece of information we could have gotten, that one day she might not have to think about this every time she goes to eat. The center relies 100% on private donations, so any kind of fundraising that we're able to do for the marathon and other ways is what's going to continue to keep the ball moving in terms of finding a cure for the disease. If we, the people whose families are touched by the disease firsthand, don't do it, then who's going to do it?
Celiac disease is extremely common. About 1 in 100 of us have it. And yet, compared to other conditions that are less common, celiac disease receives much less funding from the National Institutes of Health for research and from private foundations. Celiac disease is unique in that the bulk of the funding comes from private individuals, private philanthropy, parents and grandparents of people affected by celiac disease. They are the ones that are moving us towards a cure, towards better treatments, towards enhanced quality of life.
There's potential for us to understand celiac disease fully and turn off the trigger and prevent the condition. But the only way that's going to happen is by the injection of adequate funding to advance both the quality and the quantity of research, to put it in line with other conditions such as Crohn's disease, rheumatoid arthritis, or diabetes. Enormous amount of research and many potential therapies. Celiac disease, much less research, therefore very, very fewer potential therapies. It's volume as well as quality of research, and that takes funding. If it's not going to come from the government, it's got to come from you people out there.
We need to find a cure for this. It's the disease with a known cause, but without a known cure. There's no companies that are chasing this in terms of research and putting money into research dollars. If we didn't fund these fundraisers and the center, this research simply wouldn't happen. I mean, I can't even imagine. It's crazy. My message to people at the fundraiser tonight and also for the marathon is to be very generous because they are close to coming up with a model so they can find therapies, real therapies for celiac disease. It would make a huge difference. Huge difference.
What's the future of celiac disease? What are we going to have to offer Harry and offer Zoe and all the other kids with celiac disease? What's their future going to be like? You know, it's very important, obviously, that they'll maintain a gluten-free diet, but they're going to need support. They're going to get this from the Celiac Center. What we really owe them, however, is the opportunity to have a therapy, a medication to help them with their disorder. The Celiac Disease Center at Columbia University has made major advances over the last 20 years. Our initial research showed the clinical picture of celiac disease, and that resulted in education of physicians and the subsequent major increase in the rate of diagnosis. But it can't stop there. Once everyone's diagnosed, we've got to offer the potential of treatments, we've got to cure those with the condition, and most importantly, we've got to prevent it in future generations. It's only through research is the Celiac Disease Center going to change the future of this condition.